as a community can do better.
What do you want to tell your children about this moment?
We need reforms.
From the All Indiana Podcast Network, we stand together.
Everybody's here together, black, white, brown, everybody.
A platform for progress in our community.
We need to do a better job.
I want to show that we can be peaceful.
This is just as much our fight as it is yours.
Discussing the problems of racial inequality and solutions to combat discrimination in a conversation for change.
We'll be able to build on this.
I never in a million years thought I would embrace a cop like that.
From Wish TV, we stand together.
Indianapolis is one of many communities across the country to name racism as a public health crisis. For quite a few Hoosiers, racism is actually making them sick.
Today for our series, We Stand Together, News 8's Katira Winfrey sat down with the director of the Marion County Public Health Department, Dr. Virginia Caine.
Recently, it was declared that racism was a public health crisis. A lot of folks may say, how can that be a public health crisis? Can you kind of expound on that?
Well, you know that health looks at populations as a whole, and that's what it means by public health. And when you look at the impact of racism, it has significant connotations related to the impact of health on an individual's person. So racism can cause and present as violence, as we've seen across some states like in Georgia and of course in Minnesota with George Floyd. And as a result of those deaths, a huge negative impact on the body, but also having long exposure to racism causes a tremendous amount of stress, anxiety, which can have huge implications for your blood pressure, anxiety, depression related to the racism from a mental health standpoint. So it's got great consequences in terms of its impact on an entire population in how it manifests in so many different ways.
And that's interesting that you bring up the stress aspect. Some people may not realize just how much of a toll stress and depression can take physically on your body. Can you explain that sometimes that can turn into other types of problems?
So let me just tell you this. So like, you know, I can be in a neighborhood and I have a tremendous that fear run kind of syndrome, but if I'm in a neighborhood or community and I'm very concerned about the violence as it relates to my body, we could be seeing post-traumatic stress disorders in a number of our members in this community, not realizing the impact that a significant number of persons undergo because they don't live in that environment, they don't understand that environment or that culture, so they don't understand the real implications of having that steady stress on a daily basis, what it can impact not only the individual but the family as well.
And when you look at the protests as a whole, some people look at that as, wow, this is empowering to me. But some people may see it as, oh, this kind of stresses me out. How is this going to end up? What are people going to do? Is that another element?
Oh, so definitely, because let's take what happened downtown and just look at from our protest event, unfortunately, we had a number of violence. We had destruction of different entities downtown. And for example, I know I believe a CVS pharmacy got destroyed downtown, and we had a lot of seniors in that area depending on that pharmacy to get their medications. They don't always have the funding to take a cab to go to another pharmacy. So look how that impacted that seniors negatively from an economic standpoint. I got to figure out where to get my money until that pharmacy is rebuilt. We had so many businesses there. Now, from an economic standpoint, people need jobs. They need to work. They got to figure out how do I put food on the table for myself and my family. But with the destruction of the property, a lot of businesses had to close down temporarily. So there's so many different factors that can be related to this protest. And in the healthcare profession, for example, let me just say, I'm seeing a patient, I'm counseling a patient, you maybe have diabetes. So that means you have to eat very carefully what you eat. And I'm telling this patient, you need to do these things. And the patient comes back at another visit, and it's clear from a nutritional standpoint, they were not able to do that. And here I'm thinking that it's a non-compliant patient. If I was a provider, because if I don't understand the culture, or if I don't understand their environment or what's going on in their lives, I may not realize that, hey, there's not a grocery store near them that has vegetables, fruits that they can ascertain. So as providers, we have to have a better understanding what's going on with our patients.
I know when it was announced racism as a public health crisis, there were plans in the works or steps to try to make some improvements. Are you all still working on those plans, or have some of them already been developed?
So no, we're definitely working on those plans, but we're also trying to emphasize one of the things that I think is critical from a racism standpoint is that we have to improve the economy of everybody. We have to have this health equity in terms of income. We've been too long in the state of Indiana with minimum wage of $7.25 for over 25 years. Over 25 years, a minimum wage of $7.25. So we should at least be making a living wage. What does that mean? I make enough money to put food on my table, pay my utilities, okay, and have rent. That's a living wage. And so it's unfair that we have a significant number of our racial and ethnic populations, they may be in 8 of the 10 lowest paying jobs. As a community, I think we have a huge responsibility that if you're working hard, that you should be able to, in an 8-hour period, be able to make a living wage. And so that, I think, is the key to good health. And the second key to good health is great education.
And Dr. Caine says the health department is continuing its work with the city to develop ways to address racism in the Circle City.
Remember, you can also listen to our We Stand Together podcast anytime. Tonight's episode and others are found at allindianapodcastnetwork.com.
From Wish TV, we stand together. Watch, read, listen, and be a part of the conversation online at wishtv.com and when you follow Wish TV on Facebook. Find more episodes of We Stand Together and other podcasts from Wish TV online anytime at allindianapodcastnetwork.com. allindianapodcastnetwork.com.